Hello and welcome to July's Connect board, which is designed to give staff across the organisation an update on the discussions that we had at the Trust board meeting earlier this week. As always with our board, we started the meeting with a patient story, and this month we had a very interesting and sad patient story from our palliative care team, who gave an example of a patient's journey through the hospital at end of life, which hadn't been as good as we would have liked. It was a really powerful story, and particularly relevant this week when there's been a lot of publicity in the news about the end-of-life pathway and the Liverpool Care pathway. And one of the things that was highlighted to us as a board from this story was the need for us to make sure that we constantly listen to patients and make sure that their wishes are always being taken into account when we're dealing with them at end of life in the hospital. But also the importance of working very closely with our colleagues in GPs to make sure that the needs and wishes of patients are discussed at an early stage in their end-of-life journey, and this is something we'll be doing further work on in the coming months as we begin to think through the different approach to end-of-life care that we may take, given that the Liverpool Care pathway is no longer going to be utilised. We also talked to the board this month about the recent report by Sir Bruce Keogh, who's the NHS England Medical Director, and this report looked into a number of issues that had been raised at 14 hospitals across the country. Many of you will have seen the negative publicity that this has generated in the press, and the board understandably wanted reassurance about the performance of Yeovil in a number of these key areas. Whilst we know that we can always do better, and there's a lot of work going on across the hospital to look at how we improve patient safety and quality, we're going to be working to think about how we can produce a set of measures that we can share more widely with patients, visitors and the wider public about the quality of services at Yeovil, both from a patient experience perspective and from a patient paid safety perspective. And we're going to be looking to share that not just with our local staff, patients and the wider community, but also particularly GPs, who are obviously a very key part of the process in referring patients to the hospital. The board also discussed the recent GMC survey of junior doctors, and unfortunately Yeovil didn't fare very well in that recent survey, and a number of our junior doctors raised some concerns that they had with the way in which they were being managed within the hospital. We recognise that there have been some issues over the past year, and we're working very closely with Paul Foster, the Director of Medical Education, to look at how we can improve the support we bring in for junior doctors. And that's going to be particularly important now as we approach the beginning of August, when we'll have our new intake of juniors arriving at the hospital. We're really committed to making sure that we listen to the junior doctors and learn from them, because they're seeing a lot of what goes on in the hospital on a day-to-day basis. And we're going to put in place a programme to make sure that we capture their ideas and areas that we think we could do to improve on, to make sure that we're picking those issues up and dealing with them as and when they arise. Helen Ryan, our Director of Nursing, presented to the board on a number of areas. First of these was the approach we're taking to improving our complaints. We know that complaints are a really valuable feedback mechanism for patients and their families to highlight when we haven't got things right for our patients. We want to make sure that our complaints process is as positive an experience for the complainant, and that we also make sure that we're learning from the complaint and making changes to the way we run the organisation. We're working very closely with the Patients Association to make sure that our complaints can be responsive and we respond very quickly, that we really make sure that we resolve the issue that the patient or the relative has been putting forward as the reason for their complaint. And we're going to make sure that we work very closely and recognise the feedback from the Francis report that makes sure the complaint is always focused around improvement, not just making sure that we fulfil a bureaucratic process, because I believe it's really important that we use complaints as a mechanism for improvement, not just a process that we have to go through. The second area Helen's updated the board on was the approach we're taking to looking at our staffing levels on the wards, and there are a number of things that are going on to look at our staffing ratios compared to our dependency of patients. We're also shortly going to move to a situation where the ward sisters move into a supervisory capacity, so they're actually much more available on the wards to oversee what goes on, train and support the more junior staff, be available to talk to relatives and patients to make sure they're picking up any concerns. but we're also going to be looking at our staffing ratios and making adjustments where perhaps we might not quite have the right ratio of staffing to dependency, and that will be something we'll be working hard on over the coming months. Mark Power, our HR and Workforce Director, also gave an update to the board about our performance in delivering appraisals for all staff. And obviously all staff know that appraisals are a really important part of good management and making sure that we are understanding the needs of our staff and helping them develop their skills. We are making progress in appraisal, but there is still further work to do, and I'd encourage anybody in a line management responsibility to check their records and make sure that their appraisals for their staff have been conducted or are planned to be conducted over the coming months. Same goes really for mandatory training, which again was another area we talked about at the board, where we know there's further work to do in some areas to increase the uptake of mandatory training. One of the other areas Mark's highlighted to the board was our sickness absence rates, and whilst we've made some progress in some areas with reducing sickness absence, there are still some hotspots across the trust, and Mark updated the board on where those areas were, and some of the work that we're also doing proactively with occupational health to try and make sure that we are managing sickness absence in a positive way, to make sure that we're doing whatever we can do as an organisation to get people back to work. And Mark's leading a lot of work within HR to look at how we can make improvements in that area to encourage staff wherever possible to get back to work as quickly as possible. The board received a really good presentation from Lewis Jones, the Clinical Director for Emergency Medicine, Mandy Carney, the Matron, and Liz King, the Operational Manager for the Emergency Department, really updating the board on some of the improvements that have been going on within the Emergency Department over the past months. A number of things have improved significantly in the ED, notably our turnaround times for ambulances, where we've made some significant improvements in the way we hand over patients from the ambulance crews to the nursing staff. And that's resulted in a fantastic improvement which has led to us having the lowest turnaround times for ambulances anywhere in the southwest. And that's not just good for us in the hospital and better for the patients, but it's also good for the ambulance trust because it means their crews can get back on the road dealing with 999 calls as quickly as possible. It's really encouraging also to hear about some of the quality improvements that have been made with the emergency department, increasing the capacity of our middle grade staff in the department, nurse practitioners, physio who's able to deal with low-level soft tissue injuries, all of which is about making the experience of patients coming to the emergency department as good as it can be. And I'd really like to thank the team down in the emergency department, and the board did at the meeting this week, because they've done some great work and have made some real big improvements in the way they deliver care to our patients. Finally, we also had a presentation at the board from Dr. Paul Heaton, the Clinical Director for Paediatrics, and Tracy Fletcher, the Business Manager for Paediatrics, really giving an overview of some of the challenges that the paediatric department in the hospital are facing at the moment. Like most parts of the hospital, they're seeing increasing complexity in the patients they're dealing with, and paediatrics have done some great work to try and work in a different way to accommodate that. Notably, the introduction of the Young Persons Unit, which Paul was explaining, has been very widely recognised across the country and internationally as a really example of good practice. It was really interesting to hear from Paul about some of the challenges, but also looking to the future, thinking about how do we deliver care in a different way for children with complex disabilities and long-term conditions, how we can maximise relationships with primary care and work more collaboratively with the GPs, but also how we could work potentially collaboratively with other hospitals to look at different ways of delivering care as the challenges facing the NHS are becoming ever more apparent to us as we go forward. Hopefully this has been an interesting summary for you of the key topics we talked about at the board. As always, we always welcome feedback from this, so if there's anything you'd like to find more out about, or if you've got any suggestions for how we could improve this short summary, then please let us know and we look forward to hearing from you.